The Medical College of Georgia telehealth is super important. We connect patients in rural hospitals, out in the community, giving them resources that they didn't have before.
Telehealth or virtual care at Wellstar MCG really is a platform in which our goal is to reach patients across the entire state who really don't have great access to healthcare. And that's promoting healthcare tools, promoting physicians in those rural communities by accessing resources that we have here in Augusta to all parts across the state.
We're going to have over 100,000 physicians retire within the next decade, according to the AAMC. We're the fourth largest medical school in the country, and we've only got 304 students in our entering class. So that means we're going to have to use innovation and technology in ways that we've never used it before.
Rural hospitals struggle, we know that. We need to keep them, and we need to keep them in business as parts of the community. Well, telehealth helps us do that.
Emanuel County has a lot of healthcare needs. As my physicians have gotten older, we've seen less and less of these physicians who could do a little of everything and more of a specialty, and so it made it really challenging. Telehealth has changed that because it really gave access to specialty care without the patient having to travel for it. At this point now, you can get the care just as fast in Emanuel County as you can anywhere else.
So a lot of what we focus on here at the MCG Center for Digital Health is how do we train people so that they're comfortable communicating with patients via digital technology. We teach it because this is the way that physicians from now on are going to practice medicine. So MCG is the first and only medical school that I know about where students have real patient interactions through telehealth in the very beginning of medical school before they even go to their clerkship rotations. So as they're learning how to be a traditional doctor with hands-on patients and doing physical exam skills and inpatient interactions, they're also learning how to do it using digital means.
If you look at the program here at MCG and Augusta University, you see that they've become a leader in this area.
I've been asking for this for many years because I could foresee that this would be a great value to the rural hospitals, that there be a single center that the rural facilities could go to and request these specialty services.
I'm very gratified that telehealth is being incorporated into that curriculum because the more doctors and providers who have the knowledge of how to utilize it, the better for all of the people that they serve.
We've only begun to see the impact that this is going to have.
I'm really excited because I think the future is actually going to be much different than it is now because we're training a whole generation of how to do this along with everything else they're learning in medical school.
It's the wave of the future, and of course I think just adds much more to the quality of the care that they'll be able to give.
In 10 years from now, this will be so commonplace and it'll be in every rural facility as part of just a standard of care.